Hello everyone, I'm Dr. Anupama Chowdhry Devgan, your physiology faculty. Over the last 5 weeks, I have been conducting the daily quiz series. In this series, we have discussed all the NEETPG PYQs, PYTs, and high-yield topics in physiology. The quiz as well as the video explanations are available on my Telegram channel and on the YouTube channel. So let's have a look at today's questions. A patient presents with tachycardia and heat intolerance, and the physician suspects Graves' disease. Which of the following is not consistent with the diagnosis? So Graves' disease, thyroid stimulating immunoglobulins which mimic the action of TSH, and there is going to be hypersecretion of T4 and T3. So increased total and free T4, yes. Is there going to be a suppressed plasma TSH? Which is true, because an increase in T4, T3 has a negative feedback effect on the secretion of TSH. TRH from the hypothalamus acts on the anterior pituitary, increases TSH, which in turn increases T4, T3 secretion from the thyroid gland, and T4 and T3 have a negative feedback effect on the secretion of both TSH and TRH. So in Graves' disease, because of a hypersecretion of T4 and T3, these will have a negative feedback effect on the secretion of TSH, so suppressed plasma TSH. Exophthalmos is a very distinctive feature of Graves' disease. What about the thyroid radioactive iodine uptake? This will be increased in Graves' disease. So my answer here becomes D. A chronic increase in thyroid binding globulin will cause which of the following? So when I look at the total T4 is equal to the bound T4 plus the free T4. T4 we know is almost 99.89% bound to proteins. So when I look at the total plasma T4, it is the bound plus the free. But you have to keep it in mind that it is the free T4 which is responsible for the actions as well as for negative feedback. So now, if there is a chronic increase in thyroid binding globulin, the binding protein has increased. Most of T4 is bound to TPG. Now we've increased the TPG. If there is increase in TPG, what will happen to the bound T4? More of the free T4 will get bound. So there will be an increase in the bound T4 and a decrease in the free T4. But I've just told you that it is the free T4 which is responsible for negative feedback. If there is a fall in T4, now the TSH and TRH levels will increase and they will bring the T4 back to normal. So what is going to happen? The decrease in this free T4 is going to be transient. By negative feedback, increase in TSH and TRH will increase and bring the free T4 back to normal. The patient will be euthyroid. Yes, there is an increase in bound T4, but the free hormone will be normal. And of course, if there is increase in the bound hormone, total hormone will also increase. So answer to this question is no change in free plasma T4. So let's have a look at the other options as well. Is there going to be increased delivery of T4 to the tissues? Yes, there is an increase in total T4, but free T4 is normal. So this is not correct. Increased conversion of T4 to T3. Again, T4 is normal. Increased secretion of TSH. T4 is normal, so TSH secretion also will eventually become normal. So the best answer here is no change in plasma T4. Which of the following increases the renal clearance of phosphate? Now, what is the definition of clearance? Clearance of any substance is volume of plasma cleared of that substance in unit time. So, in other words, I'm trying to ask you which hormone will increase the renal excretion of phosphate so that the volume of plasma free of phosphate will now increase. And out of these, the only one which can affect the phosphate levels is parathormone. What is the role of parathormone? Parathormone increases the calcium reabsorption in the DCT, and it increases the inorganic phosphorus secretion in the PCT. It has a phosphaturic action. It increases the urinary loss of inorganic phosphorus or phosphate. So parathormone will increase the renal clearance of phosphate. Just one little point here, inorganic phosphorus and phosphate mean the same thing. So it's increasing the secretion of inorganic phosphorus in the PCT. There is a protein involved in absorption of phosphorus or phosphate, and that is sodium inorganic phosphorus 2A protein. This is sodium inorganic phosphorus co-transport mechanism. In the PCT, there is sodium inorganic phosphorus 2A and 2C, but parathormone specifically inhibits the 2A protein, increasing the urinary loss of phosphorus or phosphate, known as the phosphaturic action of parathormone. A patient with congestive cardiac failure presents with jugular venous distension, ascites, peripheral edema. Lab reports reveal elevated ANP. ANP decreases sodium reabsorption in which of the following segments of the nephron? The action of ANP is in the collecting duct. It decreases the reabsorption of sodium in the collecting duct. ANP has got other very important actions. ANP is a vasodilator. So it in fact decreases the systemic vascular resistance, decreases blood pressure. In the kidney, it causes an afferent arteriolar dilatation. And that in turn increases the GFR. If afferent arteriole dilates, more blood will flow into the glomerular capillaries. This increases what is known as the hydrostatic pressure in the glomerular capillaries, which increases GFR. But it decreases sodium reabsorption in the collecting duct. A 25-year-old man goes for a Dubai dune safari. The environmental temperature is 45 degrees and the relative humidity is 20%. Which of the following is the major mechanism of heat loss in this individual? The catchword here is heat loss. Now, what happens when you're exposed to very high temperatures? Now, our core body temperature is at 37 degrees Celsius. Now, the outside temperature is 45 degrees Celsius. So, heat moves from warmer to colder. So, there is going to be a tendency to gain heat. And the mechanisms of heat gain are conduction, convection, and radiation. But the major mechanism of heat gain is radiation. So once this individual gains heat mainly by radiation, his core body temperature begins to increase. An increase of just 0.5 degrees Celsius is enough to stimulate the heat loss center. Which is the heat loss center in the hypothalamus? This is the anterior hypothalamus. Anterior hypothalamus will now initiate mechanisms to lose heat and bring the body temperature back to normal. The two mechanisms by which heat loss will occur are vasodilation and sweating. How does sweating help in heat loss? There is evaporation of the sweat, which causes heat loss. So here, now please see this. It says which of the following is the major mechanism of heat loss? If the question said which is the major mechanism of heat gain in this individual, my answer would have been radiation. But this says heat loss. That means he has gained heat. There is increase in his body temperature. Now to lower that body temperature, sweating. And the heat loss in sweating is due to evaporation of the sweat. So the answer is D.